Good afternoon, everyone, and good morning, good evening, depending on what time zone you're in. Thank you all so much for joining us for our fifth session of the Social Determinants of Health Thought Leadership Series. We have incredibly appreciated everyone attending these events and watching them on our SharePoint site and have received such wonderful feedback on how they are helping us evolve together as an app team in our interdisciplinary cross-sector thinking. My name is Frank Alexander, and I'm the Vice President of Systems Transformation and Collaborative Ventures here at Apt Associates. And for me personally, as a 30-year practitioner in the health, housing, and human services field, working to operationalize integrated social determinants of health approaches across sectors has honestly been the most critical, essential, and important ingredient for successfully advocating for structural and systemic changes, and has been really transformative for me personally. So I'm just honored to be part of the team that's advancing this work. And I want to thank all the app staff who are working across our organization to advance SDOH, to the teams in our DHE and SET divisions, to all the capability centers and the equity center, and especially to our incredible leaders in the chronic and non-communicable diseases market center for pushing us forward to think differently and be stronger in our approaches. And as we kind of advance in the conversation today, we encourage everyone to submit your comments and your questions in the chat box, and we'll be fielding those toward the end of the presentation. So without further ado, I just want to welcome Dr. Wayne Giles here, who is the Dean of the School of Public Health at the University of Illinois in Chicago, and he's been the Dean there since 2017. We're just so honored to have him share his knowledge and wisdom with us. He is an epidemiologist who has completed residencies in both internal medicine and preventative medicine, and he's focused his entire career really on researching, addressing chronic illness, racial and ethnic health disparities. He served as the director of the Division of Heart Disease and Stroke at the National Center for Chronic Disease Prevention and Health Promotion, and led the Division of Population Health for the Centers of Disease Control and Prevention, where he spent 25 years of his career. And his portfolio at the CDC has included running one of the organization's most diverse divisions with programmatic and research activities in community health promotion, arthritis, aging, healthcare utilization, school health, and racial and ethnic disparities in health. He has over 150 publications in peer-reviewed journals and has authored multiple book chapters on social determinants and other topics, and has been the recipient of many awards, including the prestigious CDC Charles C. Shepard Award in Assessment and Epidemiology and the Jeffrey P. Copeland Award. So during this 1-hour presentation, Dr. Giles is going to use examples of his work in Chicago to talk about why and how place matters when it comes to health outcomes, and he's going to speak to innovative community and place-based strategies to address social determinants and improve population health. And then after his presentation, we're going to do some Q&A together, and I just really appreciate, again, Dr. Giles, you being here. Thanks so much, and we're looking forward to your thoughts today.
Thanks, Steve. It's certainly a pleasure to be here with all of you today, and I've got to say, you all have put together an amazing program series of presenters. I'm in awe of several mentors and colleagues that I've worked with over the years: Daniel Dawes, John Auerbach, Harold Phillips as well. And so just it's great to be part of this conversation. What I want to spend the next 15 to 20 minutes is going through a whole series of slides, just talking about sort of what determines health and well-being, and I think getting us to think differently about that. And I also want to use this to provide some resources for you all as you are thinking about interventions and other things that you might want to do in this arena as well. And then I think we can open it up for discussion. And as was mentioned, I'm going to use largely Chicago and Illinois as my examples for the presentation today, because I think there's some awesome things about Chicago, but it's also a great lesson in terms of issues around health, social determinants of health, and health inequities. And we can go on to the next slide. But before I do that, I'm always reminded that I need to talk a little bit about the great institution that I'm at, the School of Public Health at the University of Illinois at Chicago. We are the only fully accredited public school of public health in the state of Illinois. We are ranked 16th in the country among public institutions. We are ranked in the top 10. As with many schools of public health over the last couple of years, we have seen, I think largely because of the pandemic, a huge increase in interest in public health education, which I think is great as we try to rebuild the public health workforce. We have undergraduate programs, master's programs, doctorate programs as well, as you can see on the slide. A really strong focus around issues around health equity and community engagement as well. And we are one of the most diverse schools of public health. About 1 out of 3 of our students are underrepresented minority students. Among our undergraduates, almost half of our students are underrepresented minority students as well. And then the other thing that I will mention about the School of Public Health is our students tend to be a little bit older. So, you know, about half of our students are over the age of 30 as well. You can go to the next slide. So one of the things I like to do, and as was mentioned in the intro, I started my career as a physician and internist, and then moved to public health. But as an internist, you know, I was always pleased when, right, I had a patient who had a heart attack or had a diabetic ketoacidosis or whatever. They were hospitalized, and I was able to make them better and send them home, right? And I would frequently say, yeah, we were able to have an impact on that individual. We were able to save that individual's life. And that was really exciting for me and fun and very fulfilling. But I began thinking about sort of what can we do more in terms of prevention? What can we do to promote healthy lifestyles, to prevent disease as we move forward? And I realized that by doing the work we do in public health, we can prevent not just one person from dying, but can prevent thousands of people or millions of people. And that's really what gives me energy and excitement. And so I like to always ground things about sort of focusing not just on the individual, but focusing on communities and impacting communities as we move forward. Next slide. So this is a slide. This is the city of Chicago. Lake Michigan is to the east, and the Chicago suburbs are to the west, and then you can see north and south. And you'll notice that in the downtown area, what we call the Loop or River North area, life expectancy is 85 years. But if you go about 4 or 5 miles to the west, there's a 16-year difference in life expectancy. In the communities in the southern part of the city as well, lower life expectancy. And I think one of the questions that we have to ask as we look at this is, why are we seeing this 16-year difference in life expectancy? Next slide. But I think it's important that you realize it's not just in the city of Chicago. But it's also in, if I look across the state of Illinois as well. And so you'll note the city of Chicago is in Cook County. Their life expectancy is almost 80 years. A little bit to the west of that is DuPage County. They've got the longest life expectancy in the state at about 82.5 years or 83 years. Naperville, if any of you know, Naperville is in DuPage. And then if you go to the south, some of the more rural communities, south of the city, in the southern parts of the state, their life expectancy is 10 years. So what is causing that difference in life expectancy? And if we go to the next slide, I think if we were asked, you can go to the next one. If you go to the, yeah, perfect. People will frequently think about, well, it's about pathophysiology, right? It's about people's genes, and that's sort of what is determining how long people are expected to live, or in fact do live. But if you go to the next slide, we realize, no, there's more than that, right? It's access to care. It's the quality of the care that you get. And I think frequently people will end the discussion right there and say those are the things that determine people's life and well-being and their life expectancy. But if we go to the next slide, we realize it's more than that, right? It's about their diet. It's about exercise. It's about whether they smoke or not, right? What we'd say their healthy behaviors. And one of the stories that really got me interested in public health and prevention was a patient that I had, and her name was Mrs. Means. And Mrs. Means at the time was about 45 years of age. She was slightly overweight. She had a little bit of diabetes. She was borderline diabetic and had osteoarthritis as well in her knees. And she came to me one day in the clinic and said, you know, Dr. Giles, I'd like to lose some weight. And I was like really excited and overjoyed. I was like, yeah, we can talk about health promotion and all this other great stuff. And so I said, Mrs. Means, I want you to start really slowly, and I want you to just go outside and walk up and down your block. And she had this like bewildered look on her face. And she said, you know, Dr. Giles, it's not safe for me to walk up and down my block. And I'm not sure if when she said she's not safe, it's because she lived on a highway or close to a highway and there were no sidewalks, or if it was because of crime in her community, but for whatever reason, it wasn't safe for her to walk. And so I said, oh, that's easy. Don't worry about it. Just go to the mall and you can walk at the mall, right? Malls are safe places for people to be active. And then she got that bewildered look on her face again. And she said, you know, the problem with me going to the mall is it takes me 40 minutes on the bus each way. I've got to take 3 different buses, and it's just not, that's not going to work. I bring it up because I think it illustrates, right, how we can talk to patients or community members that we want them to be physically active, that we want them to eat healthy, but if they don't have access to the resources that they need to do that, that's going to be a barrier, an important determinant of health for those individuals. And so I think thinking about sort of how we can reduce some of those structural barriers is important. So if you go to the next slide, you realize, right, health is not just about diet, physical activity, tobacco, et cetera, but it's about those really important physical environments as well. It's about safety. It's where the parks are. It's also factors like air pollution, et cetera. And you go to the next slide. And so, right, so it is, you know, do we have those social supports, education, you know, are there issues with housing and transportation? All of these are really important factors in terms of determining health and well-being and life expectancy and so forth. Next slide. You can go on to the next slide. Yeah, so I just want you to think about sort of the constellation of all of these factors and the impact that they can have in terms of health and well-being. Next slide. And so I'm going to go back. Actually, you can go to the next slide. I think okay. So this is basically the same as the prior slide that looked at life expectancy. And this is data from the Chicago Health Atlas. And the Chicago Health Atlas is run out of the UIC School of Public Health. It provides hyper-local data. In Chicago, we have 77 communities, which you see here, but also provides data at the zip code level and at the census tract level as well. And so you can toggle between that. And again, we're seeing life expectancy. And again, to orient all of you, the lake is on the east, Chicago suburbs are on the west, you get north and south. And in all of my slides, the darker the color, the higher the level. And so here you're looking at life expectancy. And so you see communities sort of from downtown to northern parts of the city have higher life expectancy. Communities to western parts of the city and southern parts of the city tend to have lower life expectancy. If we go to the next slide, which is going to look at coronary heart disease, more deaths, you see a very similar picture. Again, those communities on the near north have the lighter color, lower heart disease mortality compared to communities on the south and communities on the western parts of the city as well. Next slide. This is looking at not just mortality, but now looking at the prevalence of diabetes. The Chicago Health Department does a Healthy Chicago survey where they measure prevalence of a number of conditions, including diabetes. And again, you see a very similar picture. Those communities downtown and north of the city tend to have lower diabetes rates compared to those communities on the south and in the western parts of the city. Next slide. This is looking at hypertension. And again, you see the very similar picture. I'm going to sort of go through some of these a little bit more quickly. But again, those communities on the southern parts of the city and western parts of the city see a very similar trend. And you could look at this with national data, and you would see the same things that some communities are going to be experiencing multiple traumas that I'm going to talk about in just a minute. Next slide. This is looking at obesity, a BMI greater than 30. And again, it's those communities on the southern parts of the city, those communities west parts of the city that have the higher mortality rate. Next slide. Now I'm going to change things a little bit. Instead of looking at risk factor, or instead of looking at diseases or conditions, I'm now looking at health behaviors. These are adults who are smoking every day or most days in the last month. And again, you see higher rates of smoking in the darker colors in southern parts of the city and western parts of the city as well. Next slide. And this is looking at adults who consume 5 or more fruits and vegetables a day. So again, this is looking at, so the darker colors mean a positive, sort of more consumption of fruits and vegetables here. And so you'll see again, it's those communities on the northern part of the city that have higher consumption of fresh fruits and vegetables as compared to those communities south of the city and west of the city as well. Next slide. And this is looking at participation in any types of physical activity. And again, it's those communities to the north that are, this is looking at people who did not participate in any types of physical activity. So the lower the number, the better. And again, you see it's those communities to the north where people are less likely to not participate in any physical activity compared to communities on the south and to the west. And next slide. And then this is looking at sugar-sweetened beverage consumption. And again, it's the communities south and to the west that have higher rates of sugar-sweetened beverage consumption. Next slide. And then this is a slide looking at, because I think this is an important determinant of what we have. This is looking at the percentage of people who have low food access. And low food access means there is not a grocery store within a half a mile of where people live. And so what you see is there's a higher prevalence of low food access in those communities south of the city and west of the city. So if we're talking about people being able to eat 5 or more fruits and vegetables or not drinking sugar-sweetened beverages, right? We're seeing those communities south and west of the city have less access to grocery stores and potentially less access to more healthy food as part of this work as well. Next slide. And then this is looking at poverty. So again, what we see is higher rates of poverty south of the city and west of the city as well. I think this is important because as we think about each of these communities, particularly those on the south or the west, what we're seeing is higher rates of hypertension, higher rates of heart disease, higher rates of diabetes, less physical activity, less fruit and vegetable consumption, higher unemployment, higher poverty in those very same communities. So I think you can think, I tend to think about these in terms of trauma. And I tend to think about sort of the multiple traumas that we are experiencing in some of these communities on the south and west side of the city. And then I think you got to think about sort of what are the interventions that we do to combat these multiple traumas that these communities are experiencing. Next slide. Oh, and then this is looking at unemployment, and you see the similar picture here. And again, so we're adding on top of poverty, low food access, et cetera, we're also now adding data on unemployment as well. So again, even more trauma. Next slide. So this is from an Institute of Medicine report that came out about 20 years ago, but I think very much resonates with us today. And it's about behavior change. And it really says that it's unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against that change. I tend to think again about the story of Mrs. Means, who wanted to change her behavior, but her environment didn't allow her to do that. And that's why intervening on social determinants of health is so vitally important. Next slide. This is the health impact pyramid. You may have seen this from some of the other presenters. And really, as I think about health promotion, right, we want to think about multiple strategies that I think are really vitally important. But it also on this slide shows the impact. And so the lower you go on the pyramid, the higher the level of impact as well. And so, yes, counseling and education are really important for health promotion, but we're not going to have the impact that we have if we change the context or if we address socioeconomic factors that can have an impact on health. So having an impact on poverty, education, housing, those strategies can have a huge impact on health and well-being and also target multiple factors as well. Next slide. These are slides from the city of New York, but really just shows the importance and the value of policy changes and sort of how, not just counseling individuals about tobacco use, but also putting in place policies can have a huge impact on population's health and well-being. So rising the price of cigarettes can have a huge impact on health and well-being. A warning about the dangers of tobacco, making sure people are protected from secondhand impact. All of those strategies are really impactful as well. And through the decade of the early 2000s, they saw almost 500,000 people quit smoking because of some of these policy interventions. Next slide. The other thing that I like to show is, again, this is from one of the community demonstrations that we did as part of one of CDC programs that I was involved with. But really was where they went into, because there were not a lot of grocery stores in some of the communities, they had these mobile stands that were used and were placed in corner stores and pharmacies, et cetera, providing people access to fresh fruits and vegetables, and sort of is what I like to think of as the real pharmacy, as part of the work that we do in sort of increasing access to healthy fruits and vegetables. Next slide. The other thing that I think is important as we move forward is that we think about sort of, can we create with sort of some of our schools joint use agreement so that our schools and the school facilities are open after hours to provide families with safe places to be physically active. Again, I'll go back to the story I told about Mrs. Means and wondered what would have happened if the school down the street from her had been opened, in the evenings for her to provide her with a safe place for her to be physically active. But that could have been a great strategy for her as we move forward. Next slide. I also want to just talk about some interventions that came out from the Centers for Disease Control and Prevention, really talking about sort of what are potential interventions that can have an impact and can have an impact relatively quickly. Frequently, we tend to think about, with funders and others, they want to see an impact and they want to see an impact quickly. And so they develop these high five initiatives. Next slide. And really, these are the ones I'm going to talk about are very much focused around community-wide prevention strategies. as opposed to sort of more clinical or individual strategy, but these are community strategies. Next slide. I think it's important that we remember that as we think about this work, that CDC was really summarizing the evidence. There were a number of other interventions that are really important that take longer. And there's a lot of work that hasn't been evaluated yet. And I think one of the things in terms of research activities, I think evaluating potential interventions and interventions in novel settings is really vitally important. And I'll talk about that in a few minutes again. But, this I think helps me to think about sort of what's a potential research agenda that one might want to develop as we move forward. Next slide. And so they came up with 14 evidence-based, community-wide population interventions, again, focused on improving health and well-being. Next slide. And so this is sort of list. And again, they focus these strategies around very much that health impact pyramid that I talked about earlier. So, there were a lot of setting-based strategies such as school-based programs around physical activity that were part of this. Safe routes to school was another really important strategy that they propose as well. This is a program for students to walk to school. They have walking school buses that there's a parent in the front and a parent in the back, and sort of provide safe opportunities for students to walk to school. But also strategies like early childhood education, again, to get at social determinants of health. That's important. The use of public transportation. I will tell you, now, over the last several months and over the last week as well, gas prices have increased substantially. Here in Chicago, a gallon of gas is over $5. That has promoted me to change my behavior. I am now taking public transportation as opposed to driving to work every day. By me taking public transportation every day, I actually walk 5,000 steps a day. So that's in many ways, I think, a good thing for me as I think about improving my health and well-being. But again, these are strategies that I think are important in terms of addressing the social determinants of health. Next slide. And through all of these interventions, you can have wide-ranging impact from anxiety, depression, asthma, blood pressure, sexually transmitted infections, but a whole array of really impactful outcomes can be addressed by implementing these high strategies. Next slide. The last thing that I wanted to mention is the Community Preventive Services Task Force, or what we call the Community Guide, which I think is another really vitally important resource for you all as you're thinking about potential community-wide interventions. Next slide. You can find a link to the Community Guide at the website, thecommunityguide.org. But you can see if you look at the topics, there's a whole host of topics and potential interventions that you might implement. And so it's a huge resource, and I think a really important resource for all of you as you are thinking about potential interventions that you might want to implement. I think this is also a potential area for a research agenda. Because I think it also highlights where the research gaps are, and I think being able to evaluate some of those research gaps I think will be important so that we can build on the evidence base that's within the Community Guide. And I think next slide is my last slide. Yes, and so I just wanted to just say again, I think it's a pleasure to be with you all today, to chat with you all, and appreciate any questions or comments that you all might have about my presentation.